Hello, everyone, and welcome to the Wealth of Health news segment. On today's episodes, we're discussing from The Independent, promising new test could detect pancreatic cancer in its early stages. Hello, everyone, and welcome to the Wealth of Health podcast. My name is Ahmed. I'm the Chief Exec of Echelon Health, and with me, as always, is Dr. Paul Jenkins, endocrinologist, consultant physician, and medical director.
Welcome.
Today, we are discussing a very important article, I think, Paul. Promising new test could detect pancreatic cancer in its early stages. And I mean, what I know about pancreatic cancer, well, the very little I know about pancreatic cancer, is that people are rarely get the chance to be treated from it. Like it's one of the most, horrifying cancers when it comes, because there's almost no treatment, or is it because it's always diagnosed very late?
It's usually Ahmed because it's diagnosed late. Yep. This is, as you say, this is one of the really nasty cancers because it has very few symptoms until it presents late. So the pancreas gland is in really the depths of our body, of our abdomen. Yes, it has a number of functions, one of which is to make insulin, so that controls our blood sugar. Yep. But the other is it releases a number of enzymes which help digest food. So that, and they are released through a duct, which then into the small bowel and helps release food. Yeah. So if you are unfortunate enough to develop cancer of the pancreas, it does not usually cause symptoms until it has significantly grown. And sadly, by the time most are diagnosed currently, around 80% of them have already spread and what we call metastasized. And so the cure of them is extremely low. And the current 5-year survival rate for pancreatic cancer is less than 5%. So it's a very nasty disease. Yes, and it causing the symptoms, it has causes obstruction to this duct, which drains the fluid from the pancreas. Yes, and that duct also drains the bile from the gallbladder. So if you get obstruction of that, one of the common signs of that is jaundice. So you get yellowing of your eyes, your sclera, and your skin.
And just like
other
liver
symptoms
problems
of it are indigestion, are discomfort in the upper abdomen. Weight loss is very common. Mood changes with pancreatic cancer is one of the classics as a doctor, where cancer can influence your mood. And so anyone who has new onset of mood change, you would think of pancreatic cancer at the back of your mind.
Like mood change, what for the worse, or just
becoming depressed, low mood.
Okay. Wow. Okay.
The reasons for that I don't know, but it is one of those associations that you do need to be aware of.
Okay. So, and this article then, I mean, I guess it's a positive sign. It says promising new blood test could detect pancreatic cancer in early stages. I mean, I know there's a lot of talk these days on blood tests, right? Exactly. Blood tests that can detect cancers. And I really want us to be able to discuss the true efficacy of these tests. Are they really good? Can they detect it early enough? Or can they detect it almost too early, we'll explain what that means, which means it's a reason for a lot of concern over potentially what's not going to be anything. But this test in particular, do you think it is really promising?
Look, it's a start. Okay. But you are absolutely right that there's a lot of hyperbole about blood tests which can detect cancers. Yeah. Either specific cancers such as this one, the pancreatic cancer, or cancers in general. And there's a test being promoted, the Gallieri test, which claims to detect all cancers on the back of a simple blood test. And the theory of this is great, that those cancers will secrete and release into the bloodstream now tiny particles of cancer DNA. And with the modern molecular biology and the incredible sensitivity of the techniques that can be used to detect those, you can detect that circulating pieces of DNA and claim that, yes, they are released from a cancer.
Right.
The issue is with them that they, and it's perhaps not surprising, that it's the bigger cancers which release the most DNA. And where you want to detect cancers is right at the early stage, because we all know the earlier you catch cancer, the higher and the better your rates of cure.
Right.
And sadly, all of these tests at the moment are not, to my mind, really detecting the early stage 1, stage 2 cancers, which offer you the highest rate of cure.
Okay. Right. But it's I think it's hard to understand at what point is early enough and at what point is
Mm.
too late, because it's a blood test that shows the existence of something. Is it the quantity of that something existing in the blood, or is it the quality of it, or how do you judge if you've tested it early
Yeah.
enough?
Well, look, the studies will have categorized the stages of the cancer. Yes,
Okay.
and there's the well-known accepted criteria in the medical world for stage 1, 2, 3, 4. Early, very early, early, middle, late, and metastatic. So the extent of the cancer, the size of the cancer, and you'll correlate that with the levels of these substance that they have detected, and they will
Right.
come to a threshold level which they think best fits the criteria between having a negative blood test and a positive one. But equally, you have to work out the false negative and the false positive. And that's where the
Right.
real issue comes from these, because you don't want to give somebody, as you alluded to, say they've got a cancer, false positive if they don't, because of all the worry about it. But clearly, you don't want to miss cancers. So you don't
True.
want a false negative. So it's always in all of this type of test is trying to get that right balance. This is a very
Right.
early study, yes, of this one. It's early days, and with all these tests, you know, they evolve like everything in medicine. It evolves, and so this may be the beginning of it. We will have small numbers of patients, so you need larger and larger numbers of patients, so its true sensitivity and what we call specificity, and you can refine the algorithms and the levels. I would say at the moment, this test, they say it's only 68% accurate. Well,
Yes.
that's going to give you a lot of false positives and potentially false negatives.
They said it is 60% accurate, but it has a higher percentage on ruling it out. So it's 68 negative, but it's 80 something positive, if that
Yes.
makes sense.
Yeah, yeah,
So
no. So it can be, but you still got that's 20%.
yes.
Yeah. So if and all these tests, they can give you the false reassurance. That's my concern with them. So there's no
Okay.
test in medicine is 100%. So you've always got to bear that at the back of your mind. Yes, or very rarely is there 100%.
So
It's just always a balance. Could you still have it? Could you not? And if when they ruled it out, what size of tumors was that? Over how long did they have the follow-up period? So for any cancers, did they appear? So
right. So can there be cancer DNA in the blood without the person actually having cancer?
not if the test is accurate enough, no,
Okay.
because the DNA is very, very specific.
Right. And can a person have cancer without having any evidence of it in their blood?
Yes. Yeah. Yeah,
Okay.
if it hasn't yet secreted, or it's at a very early stage, or it is below the limit of sensitivity of the test, which is the same with every test. You need to know what the sensitivity is of them is.
Is there a better way of testing for pancreatic cancer to
Yeah.
see it much earlier than the blood test would?
There is no current official recognized screening for pancreatic cancer. Yes. The prevalence of it in the UK is really around 10,000 people a
Mm,
year, crudely, broadly speaking, get pancreatic cancer. Yes. So it's about the 10th most common cancer. It's one of the nastiest, as I said, because,
mm,
it's picked up generally late. The screening techniques that I believe in, but they're not validated by large scale studies in public epidemiology, which is one of the big areas, for the cost effectiveness. Yes. But as always, and you know my views on this, that if you image the body appropriately, with high quality, appropriate imaging using the right modality, and with right high quality equipment reported on by appropriate specialists, that gives you the best chance of identifying abnormalities. And that will identify small pancreatic cancers. And then you
So
have a better chance of cure. I mean, the surgery for pancreatic cancer, when I started in medicine and presenting late, this is some of the most brutal surgery you can undergo. It's
why is
called,
that?
historically, it's called Whipple's surgery, Whipple's procedure, where you are really completely cutting and rejoining the bowel and the pancreatic duct. And it was, I've seen it done once. It was a 10, 11-hour operation. It's it's full on, and the recovery from that is incredibly long and difficult, and fraught with complications. So
Hmm.
it's not surgery that people would undertake willingly nowadays, particularly given that we know that the outcome is so poor.
Right.
So,
And if
but if
it's
you can identify a tumor early
yes.
in one part of the pancreas before it has spread, then yes, you are going to have a much higher rate of success with surgical excision.
Okay. And can you deal with it the usual way with like chemo and
There's some chemo, but it's not
radiotherapy?
desperately effective. But again, because it is spread. And much chemotherapy, by the time you're dealing with metastatic disease, i.e., it is spread often to the liver, around the body, you are in palliation mode, not curative mode.
Okay. And what is because the article touches a lot on that. I mean, the people they chose to undergo the study, the people who've just been diagnosed with type 2 diabetes.
Hmm.
So, what is the link between diabetes and the potential development of pancreatic cancer?
Yeah. Well, look, diabetes, especially type 2 diabetes, so that is late onset diabetes, yes, in your middle age, is associated with 3 to 5, sixfold increased risk of pancreatic cancer. Okay, so that sounds very dramatic, but you then need to look at that in the actual numbers. Yes, we
Right.
said there's 10,000 patients a year perhaps develop pancreatic cancer in the UK. There's 3.5 million individuals with type 2 diabetes.
Right.
So it's a tiny proportion. So I do not want any listeners going away thinking, oh my goodness, I've been diagnosed with type 2 diabetes, or I have this. That means I'm going to get pancreatic cancer. Not at all.
You're saying the
There are far,
percentage
far
is
more
very low.
prevalent complications with diabetes that need addressing the cardiovascular risk than the pancreatic cancer. But
Right.
other risk factors for pancreatic cancers, and it may well, you see, be related to diabetes because they're associated with diabetes, is smoking, is obesity, lack of exercise. So those are associated factors for diabetes. So
Yes.
sometimes it's difficult to tease out. There's a couple of, if you have a first degree relative with pancreatic cancer, that tends to increase your risk.
Hmm.
There's a couple of rarer genetic conditions which can increase the risk.
Hmm.
And then if you get a very nasty inflammation of the pancreas called pancreatitis, where it
Yes.
starts to, the enzymes I said which digest food start to digest the pancreas itself. And it's a very nasty, very
It's like
painful.
an autoimmune thing.
No, it's an autodigestion of the pancreatic gland.
Right.
And all the inflammation in the cells which make these digestive enzymes leak out, and the enzymes so start digesting the tissue around it.
What causes pancreatitis? Because that's a lot more common than pancreatic cancer,
Yeah,
isn't
yeah.
it?
And itself has a very significant mortality.
Yes.
Acute pancreatitis is a good going medical stroke surgical emergency. So the risk factors for that, well, chronic and excess alcohol.
Okay.
So alcoholics are at increased risk of it. Gallstones are
Hmm.
at increased risk. I mentioned that the duct from the pancreas drains both the pancreatic fluid, but also the bile from the gallbladder. So if you have a gallstone that gets lodged in that duct and blocked, it can get back, you can sort of, in essence, get back pressure, and
Yes.
it can start to cause inflammation of the pancreas. Those are the two, and just idiopathic, which means medical word we
Who
don't know.
knows?
Yes.
Okay. And so it's a very weird question. It even sounds weird asking how can someone look after their pancreas? I mean, you don't
Well,
hear
I
that
guess,
very
I mean,
often, but
yeah, it sounds trite, but we come back to the same basic health style, lifestyle issues of eating better, trying to keep the weight under control,
hmm,
clearly not smoking, and drinking in moderation. If
okay,
you have a family history, to keep in mind any symptoms. And I personally, and I know I can be criticized for this, but I don't mind that, is getting imaging if you're able to, you know,
yeah,
of the
scan,
pancreas,
get a
MRI
scan for
scan,
the
MRI
MRI
scan of the pancreas.
of the pancreas.
Yeah.
Okay,
It's
all
the,
right.
it's the
Well,
one cancer many of us and many medics and public, when they're aware of it, really don't want to miss. Because if you see someone with pancreatic cancer, as we're coming back to the beginning, by the time it presents with symptoms, it's too late and they're in very, very rapid decline and they
hmm,
often pass away within weeks.
wow.
So,
But you stressed on smoking. You said
mhm.
absolutely no smoking and moderate drinking. Why didn't you say moderate smoking and no drinking? So,
Well, look, I mean, any
is
tobacco is bad.
smoking directly related to causing harm to this area? So, in particular,
It has
smoking, or
been significantly associated with an increased risk. The
really?
mechanisms of it, I don't know, but smoking nowadays, we know the risk of lung cancer, the risk
Of
of
course,
cardiovascular disease, of virtually every illness, prostate cancer, you know.
yes.
Every time I'm going to be brutal and we can, I can be this as a medic, yeah. But every time someone has a cigarette, you're playing Russian roulette,
Hmm.
you know. I mean, it's such a straightforward and the easiest thing to do to improve your health span and longevity is, if you're a smoker, is to quit.
Yes,
And
I
people were
see.
coming off tablets slightly, but people often say, "Oh, well, my gran, she smoked at 95 and she was fine. I'm okay." Okay, your gran was lucky. Maybe you will be lucky, but
And maybe you
statistically,
won't.
it is the biggest factor associated with disease and the easiest preventable. And let alone, Ahmed, the cost of it. The price of cigarettes now is.
I know it's insane.
So if you were to add all that up and put cash into your bank account or a little savings account, you would have a very nice holiday at the end of the year.
That is true. That is true.
So
It's the prices are ridiculous. But I do see less and less people smoking now, even on the street or in public. Like
yes.
you almost rarely see someone smoking.
Well, hang on. What I was just seeing in the paper the other day, some film stars that they were trying to, glamorize it again.
I don't think it's a glamorizing, and I'm very conscious we're going off topic. But
Yep.
if smoking is one of the factors, then let's
Yep.
discuss it. I don't think it's glamorizing. I think there was an appeal due to a massive misunderstanding or ignorance at a certain stage during film history, and it was glorified, associated with the villain or the bad boy. I
Yep.
don't think people care about it that much these days, to be honest. It would be very funny to see a villain vaping.
Yes.
That would be much funnier. 'Cause it
Yeah.
would be kind of moving on with the ages. Okay, if you were the article also talks about something important which we should touch on, which are the symptoms
Yeah.
of pancreatic cancer. So can we speak about those symptoms a little bit? You mentioned
Yes.
one of them, which was jaundice.
The jaundice is as I said, that's the sign of late stage disease.
So that's late stage.
Yeah.
Okay,
Well, that's the trouble. That's when the vast majority present is
that's
late
what
stage.
people will notice as well.
Yes, yes, and the relatives notice. It's the weight loss. The classic, like any advanced cancer, is unexplained weight loss. So
Okay.
as a medic, if somebody presents with that and says, "I've been losing weight and I don't know why, there's been no real change in my diet," the
Mhm.
pancreatic or any cancer you are thinking of, and pancreatic cancer is right up there as one
Any
of.
any early signs people should watch out for?
No, I mean, look, occasionally it can present with diabetes, because if it has destroyed the insulin producing cells of the pancreas, then you present with diabetes. Especially that's what we would call more late on or more insulin dependent, so type 1 diabetes. So people
Okay.
presented with diabetes requiring insulin in
Mm.
their late middle age, 60s, 70s, you have a high threshold to consider pancreatic cancer.
Okay. So if you have diabetes, then it could be caused by
Yes, but usually it a type of diabetes requiring insulin, and
Right.
that is very unusual in a middle-aged stroke 60,
Understood.
70-year-old person. So,
Okay.
and then it's the non-specific symptoms: abdominal discomfort, central upper abdominal pain, yeah,
Hmm.
fatigue. I mentioned sometimes the change in mood,
Yes.
indigestion, change in bowels. So some quite non-specific, non-specific symptoms.
And that's part of the problem, isn't it, for that special
Yes, yes,
type of cancer?
yeah,
Okay. Well, hopefully this study, and as it progresses more and they get a wider base for their test, it will um, improve, or we get a much more accurate measure of it.
absolutely.
And
Yeah.
these blood tests, do you think once they're tested and they're done, that's it? Or are they constantly being looked at to improve efficacy and to be able to detect things earlier? Like, how does it work in the scientific community? The
Yeah,
test
no.
is done, they selected the pool of people, this is the result, thank you very much. Or do they still keep working on it to make, to until it has a better efficacy and it can detect things earlier?
Yeah, absolutely. It's a constantly, evolving field, and it's a rapidly progressing field, and it is. There's no doubt it's a very exciting field. The chance of, but people can be slightly swayed at the moment by the promise and the hype,
Okay.
because we would all want a simple blood test which will then detect if you've got cancers. So there are a lot of companies out there promoting this sort of test and saying, yeah, this is the holy grail for cancer detection. You don't
Right.
need any other test, just the blood test. Yeah. But as I said, most of them, or all of them to date, when I've looked at the detailed studies and you break down the type of tumor, the size of the tumor, the stage of the tumor,
Hmm.
the real sensitivity of them is for late stage tumors, which would
Okay.
cause symptoms, or the cure rate is low. But with time, I am sure it's a constantly evolving field, and as the ability to know what sort of particles the tumor releases and this increased sensitivity of detecting them, but then we will get better and better.
Well, I think that's a positive enough note to end the show on. I hope the people watching us manage to get some useful information that they can take back into their life and from in terms of practicality. So thank you very much, everyone, for watching. If you did like the video, please like, subscribe, and leave a comment. From me, thank you very much. As always, it's Ahmed.
And goodbye from me. Thank you very much for listening and watching.
We'll see you on the next one.